All right. Good afternoon, everyone. Welcome to the UC Center for Climate and Health Equity Climate Hub. We're talking about patient-centered education in the era of climate change today. My name's Heather Whalen. I'm a physician, a hospitalist. My clinical work is at the San Francisco VA Medical Center. I do work in climate and health education, and I am one of the co-facilitators of the Climate Hub. I'm going to pass it to my partner.
Hi, everyone. Welcome, and thanks for joining our Climate Hub session. I'm Dr. Hilary Yong. I'm a attending physician in the pediatric emergency department here at UCSF within Benioff Children's Hospital. I'm also assistant professor in the Department of Emergency Medicine, and I co-lead and co-facilitate this Climate Hub with Dr. Heather Whalen. So excited for this session. As a reminder, this is our quarterly Climate Hub meeting, and we're hoping to build community and provide a space for you to connect and bridge silos and potentially collaborate on climate and health education, healthcare sustainability and advocacy engagement related to climate change and climate justice. So today's session will explore how clinicians in the San Francisco Bay Area see climate change affecting their patients and how they're integrating patient-centered climate change education at the bedside. We're excited to start off the session with two great presenters, Doctors Catherine Gundling and Allison Chan. And then we'll launch into a panel discussion with our expert clinicians, Doctors Jessie Liu and Nita Thakur. So I'll hand it over back to you, Heather, to introduce our presenters.
Great, thank you. All right. So I'm going to introduce Dr. Catherine Gundling, who is an emerita professor of allergy and immunology in the Department of Medicine at UCSF. And for the past 5 years, she has served as the Director of Academic Engagement for the UCSF Office of Sustainability. And she's mentored many medical students who are building a sustainable and just future for all. One of these projects, the Planetary Health Report Card, has now been implemented at 90+ medical schools in 11 countries. And she, as a recent recipient of the Edward A. Dixon Emeritus Professorship, Dr. Gundling has focused on the role of clinicians in caring for patients impacted by acute and chronic climate events. She is also collaborating with colleagues in the Academic Senate to evolve the culture of academic travel in the 21st century.
It's my pleasure to be introducing Allison Chang. She's a third-year medical student at UCSF. She's treasured the opportunity to actively engage in a community passionate about the impacts of climate change on health. And alongside with her mentor, Dr. Catherine Gundling, she began to explore how healthcare providers can effectively engage patients in discussing their climate-related health risks in the clinic. She's also actively working with other student leaders on the Planetary Report Card, as Heather had described, and she'll be starting her MPH at Johns Hopkins University this year with a concentration in climate change and food systems. So thank you to you both, and I'll pass it on to you, Catherine.
All right, thank you. I will screen share here, and we'll start our slideshow. All right. Well, it is so wonderful to be here. Thank you so much to Heather and Hilary and Sapna behind the scenes for bringing us all together for discussion of a topic, patient-centered education in the era of climate change, that I think is close to all of our hearts. And what a just wonderful thing that we have some very experienced clinicians who are dealing with some of this firsthand. And I'm looking forward to learning from our panelists as well. So before we start, I do want to just say that we have some good news. And the good news is that as health professionals, no matter where we live or what our political leaning, we all care deeply about the health of our patients, families, and communities. And this is great because what it means is we have a commonality on which we can build discussions that are both positive and productive. Health is really a great leveler when it comes to talking with friends and family. So I'd like to start today's session by just taking a look at where we stand now with health professional engagement at this intersection of planetary human health, climate change. And at the moment, we're really working in two large spheres. On the right, I would say one sphere is sustainability, and this we usually refer to as healthcare's impact on the environment. And many of you are involved in wonderful efforts to decrease the greenhouse gases produced by our healthcare institutions, decreasing our own medical waste, to really address problems with pharmaceutical waste, not to mention the local pollution that we produce just on the basis of our activities, which ironically harms the people that we're trying to help. So sustainability and healthcare's impact on the environment. Well, many of you are also involved in public health issues. We know that our warming planet has resulted in population displacement, food scarcity, freshwater shortages, rising sea levels, flooding, et cetera, et cetera. These are just some examples. So this we can refer to as the environment's impact on healthcare. Well, with that knowledge, we are now learning about challenges to our patients. Mental illness, heart and lung disease from air pollution and wildfire smoke, vector-borne diseases, not to mention sinusitis, allergic rhinitis, asthma related to prolonged pollen season. Just a point of interest, especially in the plain states and our Northeast states, ragweed, which blooms in the fall, now is lasting an extra month or two because of delayed frost. So it's not as much of a problem here, but it's a major problem for our patients with severe ragweed allergy. All right, so that leads to the question of we have this general knowledge now about things that are happening as a consequence of these public health issues, but what about patient care, which we now need to build onto this knowledge base of public health and sustainability. So how much does all of this information so far inform clinicians about how to care for their patients? And I think we would all agree that the answer probably is definitely a little bit. So we have a little bit of knowledge, speaking to some of the conversations that we were having earlier as a group about what evidence do we have to show here. There's a little bit. We know from recent surveys of clinicians that there's a passion to help, and our general knowledge about medical implications of global warming is improving, but clinicians are describing not unsurprising barriers, time constraints. Where do I get the time to now learn about this new climate medicine specialty, if you will? Or lack of implementation strategies and resources very generally. And some specific identifiable needs that clinicians have recognized are CME. Why can't we obtain CME credit while we're trying to learn how to care for our patients? And we'll see that there are some beginnings to that. We also need training in effective communication strategies, not just with our patients, but with families and the public as well. And clinicians are asking for patient education materials and science-backed effective interventions. Boy, we need all of this, don't we? So in short, there's a yawning gap between the desire of clinicians to act and their ability to do so. But yes, we have taken in some important baby steps. And so for a few moments here, we're going to look at some of the resources out of there that have come of all this. So a few examples of patient education resources. I'd like to draw your attention first to this wonderful, pamphlet on the right-hand side that was created by two of our UCSF medical students, Serena Blacklow and Raj Vidadu, have now graduated. I hate it when they graduate, but it's all good. They've created a variety of pamphlets like this that are assembled with evidence-based methods for creating effective information for patients, so they then know how to ask questions of their clinicians. And I've given you the link to this, and there are a number of other pamphlets in addition to this one, and bonus, they're also in Spanish and some in Chinese. So it's a wonderful resource. And on this page also, you can find other helpful patient care resources. And I've given you links there for two that relate specifically to caring for pediatric patients and their family members. These are mostly related to health information, not so much related to specific tools or engagement with patients, but lots of good advice. And one site that I had to add because it seems so important and relevant is from the CDC, and that's for climate health tips during pregnancy. And all of us have learned by now that severe air pollution and severe wildfire smoke, we do have data that this has very significant negative implications for the health of the pregnant individual, as well as the health of the fetus. Just a few more. Climate Health Connect has created some posters that, if they're relevant for your practices, you are welcome to download and use those. And a great shout out to Medicine for a Changing Planet, which is a collaboration between University of Washington and Stanford University on creation of case studies, which I'm so excited to report as of last month. Well, I guess it'd be actually month before because we're now in February. As of December 2023, they are now offering CME for completion of these case studies. And as an example might be an 83-year-old woman who is having difficulty at the start of a severe heat event. And they walk you through that case presentation and how to manage that patient and what you can do about it. So that's getting closer to actual patient care. But for tips on how to engage with patients, how to start these conversations, there's very little out there. But I would recommend to you a specific paper addressing climate-related health impacts during the patient encounter, a practical guide for pediatric dermatologists. Kudos to one of our young dermatology faculty members, Sarah Coates, who senior authored this paper. And I would like to recommend that you take a look at Table 1, which has really practical scenarios of how you can start to engage patients in conversations about the impacts of what's happening with the climate on their specific healthcare issues. And I've given you the link there. So what that means is that we do have some resources that we can already use, but we're really, as you all know, at the very beginning of trying to develop really excellent evidence-based resources that we can use when we're facing a patient. And after all, probably 90–95% of all health professionals are involved with patient care. So this is critically important now that we build this kind of quality information. So this really gets us back to the who, what, where, when, why, and how. Certainly with who, we know that we can start with identifying the most vulnerable of our patients, but we need more information. And what we're going to slide into now is a closer look at one way we can address the where and when in our own practices. And to do that, we're going to hear from our wonderful third-year medical student, Allison Chang, who has a paper, Evolving Patient Care in the Era of Climate Change. And she has worked on this foundational concept of time point opportunities, which can help us to identify starting places within our own clinical spaces. So it's one way to start thinking about this in our clinical practices. With that, I'm going to stop my screen share and turn it over to Allison.
Thank you so much, Dr. Gunling, for the warm introduction. I'm just going to get my slides up here as well. And I'm really excited to be here. And to briefly introduce our project, our goal was to first conduct a broad baseline assessment of what's out there at UCSF by asking our clinical leaders the general question of what patient care communications, if any, occur regarding the impact of the changing climate on health. And to do so, we surveyed the schools of medicine, pharmacy, dentistry, nursing, and across numerous clinical sites, including the VA and the General, from October 2021 until May 2022 by email and with additional follow-up. And from this inquiry, we learned that only 5 clinics confirmed that they currently engage in environment-related communications with the patients, with changes in the environment really prompting clinics to respond accordingly. And some examples included text messaging for poor air quality days done by the General, the pulmonology division there, and anticipatory guidance for insulin management without refrigeration, for example, advising patients to have gel packs or coolers on hand, done by the endocrinology division at the VA. And while many clinics indicated that they don't currently engage in point-of-care climate communications, some faculty did comment on additional needs, in particular regarding disaster preparedness resources, such as how to inform patients about medication storage and supply, and the associated challenges they might face with closed pharmacies or insurance issues with stockpiling medications that might actually prevent them from having an adequate supply in times of emergency. Some clinics also expressed sincere interest in engaging these topics with their patients, but lacked the time to create necessary tools such as formal patient education materials. And as Dr. Gudling referenced, numerous other colleagues from UCSF, Raj and Serena, have similarly acknowledged this need for good patient education and have created these beautiful infographics available in multiple languages regarding the health effects of wildfires. I'd just like to take a quick minute to discuss what we particularly like about their resources. Namely, they very clearly identify an exposure, describe symptoms, and propose actionable advice to the reader about any next steps. In this case, for example, how to check air quality. They also use a 5th grade reading level, have diverse visual content representing various skin tones and abilities, and are accessible in multiple languages. And just a quick plug, Raj and Serena have created numerous infographics on the effects of wildfires on general health, lung health, heart, skin, mental health, pregnancy, all available online. And we invite you to consider using these resources for your patients. But ultimately, this common shared sentiment of how do we get started inspired us to further brainstorm how we can bridge the gap between this concern for growing health harms of climate change and the lack of tools and data that we currently have to care for patients in this regard. And in this process, we realized that each patient has a healthcare journey and that there are many points in time for intervention. For example, depicted here, a patient with asthma may have a routine clinical visit with their PCP, or in the case of a wildfire, have an asthma exacerbation that requires an acute care visit to the ED. And on this healthcare journey for our patient, we can take the opportunity to intervene in a meaningful way and share pertinent information about climate with our patients. And this led to the concept of optimal time point opportunities for patient engagement, which was cultivated during a virtual workshop, which undoubtedly several of you all were important contributors, and further developed into interventions for climate health communication. This diagram illustrates many of those time points that are customizable to your clinical setting, whether that might be inpatient, acute care, or outpatient visits. And here, if the attending physician identifies that a patient could benefit from good education and clear discharge instructions to prevent subsequent hospitalizations, this is a golden opportunity for interprofessional collaboration. Examples of how that might occur in the inpatient setting, seen here in the bottom right corner, where a hospitalist can engage our pharmacy colleagues to provide additional instruction on storage and use of medications in the event of extreme weather, or with asthma educators to reinforce proper use of medications, along with more precise instructions for when to seek assistance. And importantly, we also need to have the tools to identify patients in our clinics who are most vulnerable. And one example of how that might happen in the outpatient setting, seen in the upper left corner, is to add a quick question on the intake for new or returning patients, such as, do you worry more about your health on hot days? And if the answer is no, that also opens an opportunity to talk about the impact of climate on their health. Alternatively, in the waiting room, a patient may access a brochure or a poster like the one that Raj and Serena beautifully created that lists potential questions for them to ask their doctor, such as, do I have any risk factors that can make smoky days more dangerous for me? And here we hope to encourage a two-way dialogue between patients and providers for conversations to be inclusive and also effective. And also, I just like to add, with developing technologies, clinics might innovate new ways of protecting patients during seasons especially prone to extreme climate events, such as wildfires. And this might entail utilizing emergency text alert systems through partnerships with the public health department, or conducting wellness calls, for example, to ensure patient safety. You can likely think of other opportunity time points that we should add to our list, and we hope to continue expanding on this diagram for optimal climate health communication with our patients, which I'm sure we'll be able to do after our session today and hearing from our wonderful panelists next.
Well, that was excellent. Thank you so much, Catherine and Allison, for your presentation, but also for leading this work. I've definitely learned a lot. I hope that our audience did too. So at this point, I do want to start engaging the audience. And if you have a question for our discussants or presenters, please post that in the Q&A, and we'll try to address that towards the end of the session. I do want to now engage Dr. Liu and Dr. Thakur in a discussion, two of our expert clinicians. I first want to introduce Dr. Jessie Liu. She is a family medicine physician at La Clínica de la Raza. She's a member of La Clínica's Climate Health Working Group, a multi-departmental team that is spearheading the organization's response to the climate emergency centering environmental justice. Within the working group, she currently helps to lead the nature prescription and text alert programs and provides clinical guidance for adaptation and mitigation. She previously worked in environmental public health on water and sanitation research and patient family education as a co-founder of Nora Health. Dr. Nita Thakur, she is an associate professor and co-director of the Partnerships for Research and Implementation Science for Equity, also known as PRIZE, at UCSF. Her research program focuses on the short and long-term health effects of multi-level stressors, including how these stressors amplify the effects of climate change in disproportionately burdened communities. In her work, Dr. Thakur partners with environmental justice communities to co-create place-based mitigation strategies to reduce the health effects of these stressors. She's also the medical director of the Zuckerberg San Francisco General Hospital Chest Clinic, and she served on many expert panels, including the EPA Clean Air Scientific Advisory Committee and the National Asthma Education and Prevention Program Coordinating Committee. So thank you to both of you for joining us today, and I look forward to a very rich discussion. I'll hand it over to you, Heather.
Thanks, Hillary. Big thank you to Dr. Liu and Dr. Thakur for being here and being pioneers in this work and sharing their expertise. So I wanted to start off just to hear maybe from each of you a little bit about your clinical roles, how you see climate change affecting your patients. And I think referencing our previous discussion from Drs. Gunling and Allison, in your practice, where do you see time point opportunities and, or are you using them already? And maybe I'll start off with Dr. Liu.
Sure. So I am a family medicine physician pretty recently out of residency, about 4 years ago. So I do a mix of primary care, OBGYN, do labor and delivery, and then a little bit of hospitalist work. But a lot of the work that I'm doing with regard to climate is specifically in our primary care and teen and children clinics, as well as with prenatal care, since we know that extreme heat, climate events, poor air quality can disproportionately affect medically at-risk patient populations, such as pregnant patients. I work with I think that's something that I really want to be leading with, is that I am one of many people at La Clínica who are working on climate, that it's not just from a clinical side. It's been really important for us to have administrative engagement and participation at all levels, from the mental health, from our Cultura y Bienestar group, which works with more indigenous and culturally appropriate, I guess, practices and beliefs, in order to be looking at this as a way that we can support community health for, I think, our predominantly Spanish-speaking patients who are who have a lot on their plates already and thinking about ways that they are trying to survive with, making an adequate income, housing, to add one more thing that is out of their control is hard. So I think trying to frame it as these are the things that you can do that are within your control to protect the health of your families and yourself is key. So I could not do this on my own. I have such a big team of people behind me, and we try to address some of these touch points when there's health shocks, when people are coming in with an asthma or COPD exacerbation, and addressing this as, oh, these are certain triggers. And also there's been more, have you noticed that there's been more smoke in the air? Oh, and helping people to see from the things that they can observe with their own senses and not just have it come from a scientific or a research perspective of these are the things that you have the tools to be able to notice, and these are the things that you can try doing. And I'm happy to speak more about specifics shortly.
Yeah, thank you. So what I'm hearing is that some of the time point opportunities for you are when patients come in to engage in care that may have been triggered by climate related conditions, and that you have folks working in the community as well. Are there other time point opportunities that we didn't talk about that
yeah, and also for our text alerts program, we got a Cali PA grant in order to send out text alerts to medically at-risk patients when there's high heat, AQI, or temperatures above 95 for 2 days consecutively in certain counties, and then above 90 in other counties, depending on where they're living, as well as the high AQI is above 100. And then there are very specific tips on things that people might not know, not drinking alcoholic beverages, don't drink juice, don't drink soda, try to be taking cool showers, cool from the outside, don't just drink water, but make sure that you are, lots of other things. And not to be, I think that there's some other aspects that people don't think about, such as burning things inside of the household that might be adding smoke. A lot of people think that humidifiers are able to clean the air, and we have gotten resources and provided workshops on teaching people how to use a box fan and a MERV filter to create cheap air HEPA filters, essentially, to be able to clean the air at home. So taking advantage and trying to address this from when there's a environmental event that triggers a mass text to 10, I think about 20,000, 15 to 20,000 patients or so. And then being able to also address this in our individual clinic visits with providers and healthcare, mental health providers.
Great, thank you. So system-wide and individual interactions, and then sounds like kind of a just-in-time strategy sometimes with these climate events, so that when these things are in people's minds, they're more receptive to the message.
Exactly.
Yeah.
And at the start of the summer in particular, we put up just colorful posters that are most of our patients. I think that visuals work for everybody. So they're very visual. We choose things that we've adapted to our patient population, as well as found useful resources online that highlight more action-oriented things that people can do.
Yeah, and I really like that you mentioned some of your strategies also letting patients know what's within their control.
Yeah.
Fantastic, thank you. I'm gonna switch to Dr. Thakur, just to answer the same question around your clinical role, how you see climate change affecting your patients, and what the time point opportunities you see are in your practice.
Yeah, so as mentioned earlier, I'm the medical director at the San Francisco General Hospital outpatient pulmonary clinic. So there I see patients in the outpatient setting. I also work in the inpatient setting. So I work both in the intensive care unit and also on the pulmonary consult service there. And then in the overall San Francisco Health Network, I'm also serving as a subject matter expert on all things pulmonary and also related to climate change. And so in that capacity, have been able to inform some of the strategies, including similar texting campaigns in preparation or during events. I'll just take I mean, Dr. Luke gave really great examples of a lot of things that we also do. So I'm just going to try to be additive to add in additional things and considerations, and also just like where I started seeing this becoming more problematic in the outpatient setting. And it goes back to actually the 2020 fire. And it was, we noticed it with the 2018 fire. I think the 2020 fire was where like, oh, this is going to be a chronic problem, where we're now having wildfire seasons happening every single year. And we noticed a trend where we were having more and more patients in our chest clinic starting to report symptoms like 2 to 3 weeks after the fire, and coming in. And they may not be meeting our metrics of like how we're counting emergency visits or hospitalizations, because they're under the radar and they're coming into the outpatient clinic where we're able to support them. So sort of in response to that, we were thinking about it from an anticipatory guidance lens, as opposed to a reactive or just in the moment lens, just at the time of an event. So we started creating our own materials because there weren't a lot of materials at the time. And they're very infographic. And they're less about like how wildfire smoke and extreme heat impact health, because our patients already knew what the health outcomes are. They were coming in and they're complaining about them, they're experiencing them. So we have a very short little infographic on that. But then the rest of the page, it was all actions. And yeah, include everything that that's known, but also things like don't vacuum during a wildfire smoke event because you're going to pop up the particulate matter in your home. And then even talking about like if you're going to drive somewhere, you know, put it on recirculate so you're not bringing in the indoor air from or outdoor air indoors. And then also instructions on how do you know if you have central ventilation in your system, how do you know it has the right filter in place? And then also directions on how to do your own box filter. And we tested them with our patients to make sure they were easy to understand, and what parts did they like, what parts they didn't like, what did they wish they had additional information on. And then that has resulted in the handout that we use now in clinic. And we start have incorporated as a pre-clinic conference for our fellows and trainees that are in clinic about like, how do you provide anticipatory guidance for wildfire smoke events, particularly because we're a respiratory clinic, and then touch on extreme heat. And then every May, I remind everyone like, hey, we're going to be entering wildfire season and extreme heat season. This is a good time to check in with your patients over the next few months. Have they replaced their filters? Do they have an air purifier? What is their strategy during an extreme heat event? And then also asking them about like supplies, right? Like if, you know, one of the number one recommendations during these events is to stay at home, right? But if you don't have a 2-week supply of food, medications, and water on hand, you're not going to be prepared, and you're going to be going out during these events, and it's going to be a lot harder. So that's sort of what we've done more at the individual level through my other work. And I think, you know, many of us who, you know, provide care within safety net healthcare systems and know that the housing quality that our patients lives in is pretty poor. So I do want to say, like, you know, as a health physician, you carry a lot of advocacy power. And so been working closely with SFDPH and also environmental justice organizations to not just study how housing quality can impact and increase risk during extreme heat and wildfire smoke, but also take on my advocacy hat as a healthcare provider and trying to implement and or advocate for policy change in those spaces. So I see it as both, like you can provide things at the individual level for your provider, but also thinking about like what power the white coat holds. And as a clinician or a healthcare provider, what can you do? Because those patient stories are really, really helpful in making change. in 2020, I had the privilege to testify in front of Congress on this topic, and being able to share the stories from my patients is a powerful tool for advocacy. So I think it's a mixture of both. So those are, in addition to many of the things that Dr. Liu said, those are some additional time points for entry, but then also what else we can think about doing as a healthcare provider.
Yeah, thank you. That's a lot that you're doing. And so I'm hearing like adding in sort of this anticipatory guidance lens in addition to sort of like just-in-time notifications for patients in an extreme climate event so that they are prepared and have all the necessary things that they need. And then it sounds like also just like timed reminders to providers as well to kind of help support the patients at the right times. And then, it sounds like you're incorporating this into education as well for your staff and trainees so that you sort of then multiply your patient education effect. So lots of different things. And then the advocacy role, extremely important. I'm curious, and I will also just want to take a moment to invite the audience to put in the chat time point opportunities you see in your own practices, so we can hear from you as well. And so for right now, I'm going to move on to another question, which is related, but are there particular strategies that you've developed about, I think it sounds like for a lot of your patients, as you mentioned, they know that climate is affecting their health, right? They know their asthma is worse when there's smoke in the air. They know that they're not feeling as well when it's very hot out. Some of these things are obvious. But maybe in situations where it's not as obvious how it affects maybe other health problems that they have, are there ways that you open up this conversation with them, especially since there can be a variety of views about climate change? Do you have any like best practices that you've developed about how to open up the conversation, I think in a way that is helpful to the patient, not overwhelming, and that, you can help them come away from the visit with something actionable, as you've already said. And Jesse, maybe I'll move over to you for that one.
Sure. Certainly, for example, for our patients with CKD or chronic kidney disease, there's a whole slew of conditions that myself and my colleagues, when it is heat season, we are more reactive. So thank you, Dr. Thakur. I think that I was taking notes too, like, yeah, we should remind our patients to have a 2-week supply. Anyway, so it's a good reminder. But when patients are coming in, we do take advantage of the time of to make a note of making sure that this is something that is on people's radars if they are at higher risk for dehydration, for acute kidney injury, for having strokes, heart attacks, preterm labor. Checking in with them. My approach is not to use exactly the words climate change. My role is really to help to them to care about their own health, and many people in the population I'm working with, and maybe in general, care more about their family's health too. So bringing it in as, I open it up as how are things going, and then they start talking about something. I look for any opportunity to be like, yeah, it's certainly been hotter. You can see that you're needing to give your kid more water, and you should also drink for yourself too. And these are the reasons why. And even if you are taking a diuretic, continue to take it, but make sure that you're drinking water and using towels to cool from the outside. I think just we're so busy in clinic that it's oftentimes difficult to get into a conversation about the mechanism behind the why. It's more of a helping them to feel empowered and have agency over being able to take the correct actions and to identify things when they're happening. I had one day when I think it was the day after from a heat wave, and there was a patient who came in who hadn't had seizures in 4 or 5 years, and extreme heat, I learned, can lower the seizure threshold. Someone else had just been hospitalized for an AKI. And it was just using that as do you remember that it was really hot in like the week before? making sure that you're staying hydrated, making sure that you're continuing to take the medications that you're supposed to extra carefully, since we know that all of our patients aren't 100% compliant, myself included. So it's just helping to heighten people's awareness around this time of things that are in their control to be doing. And I did see that there was a question about the mental health aspect. I do mention it. It's always more of a patient-led discussion around it. And also people are pretty aware too. And I oftentimes bring up in conversations, because I'd say 90% of my patients have some mental health concerns that they're bringing up, that nature is curative and healing. And it's something that I bring up quite regularly, of asking people how often they're able to either make it outside or notice the flowers, notice how the weather is, to feel in touch. Some of our patients are coming from places where there's access to a lot more nature, and we've done some photo survey things with our teens who have identified that being in an area without ready access to the forest and the rivers that they had grown up around is really stressful to them. It's really hard for them to desal God. And it's something that we try to help people to find places that are nearby. We take patients out through a collaboration with East Bay Regional Parks with free transportation, free food, in order for patients and families to come into parks where they may not feel welcome, don't even know that are nearby, and really hearing from the patients themselves how much they feel healed by nature, and then also feel responsibility to be helping to care for the trees and the environment is really moving and powerful.
Yeah, that's fantastic. Thank you. And I'm just noting at the beginning of this conversation how you mentioned that you don't specifically say anything about climate change necessarily with these conversations, right? Really just focusing on what the patient's needs are and how they see the environment affecting their health.
Yeah, and a lot of these patients already know. Many of them are climate refugees coming from Central America, coming up because there's not as much farmable land. Yeah. My role isn't to make them feel more helpless.
Yeah, and yeah, that makes sense. And then less focus on like, why is this happening, and just what can you do to protect yourself and your family, which seems great. And then finally, I think I really like this connection you're making with like nature as a resource for them, and just a reminder of that, and facilitating their access to that, since in some cases that's not really very possible depending on where they live. So thank you for those. I'm going to transition over to Dr. Thacker. Yeah, to answer the same question, just about how you engage in these conversations, and anything you want to share about that.
Yeah, so I think similarly, we don't also talk about climate change as the main issue, but we talk about the events and how our patients can help feel empowered to be prepared for the events. And we also try to stress that the way the health effects could be very, very subtle or be very obvious, such as a COPD exacerbation. In fact, we recently, with 7 CBOs in San Francisco, surveyed like over 500 residents from higher risk communities for having health effects from wildfires. And the number one symptom that's been felt during these events is fatigue. And so, just being explicit and sharing that, like, you may just feel tired and off during these events. And that may just mean you need to pay extra attention and drink more water, try to eat higher quality fruits and vegetables, and just be attuned to your respiratory symptoms, and how you're doing. And if something feels off, like, we do have a way for them to reach us and to reach out to us. We also have a program called Health Advocates at San Francisco General, which links or provides a lot of resources for different different social services in the community, so such as like food banks or food and veggie giveaway programs for housing and so on. And while we may not, as an adult medicine clinic, we don't have access to the actual navigators, but we do have an access to the paper form that actually provides all the names and the contacts for where our patients can outreach to. And so kind of thinking about like making sure that they have access to the resources they may need to be able to be safe and secure during these events. So that's one thing that will bring how we'll end up engaging with our patients around the topic, is trying to provide them with resources so they feel empowered during the events, that they can protect their own health. And then there are a couple of programs. I put one in the I guess now answered questions around air purifiers. And so the Air District does have a air purifier distribution program for those that have chronic medical conditions. And so you can access air purifiers that for patients that may benefit from them as well. There aren't a ton of resources right now, but those are some of them that are available in the community and also across California for this program in particular.
Yeah, thanks.
I'm going to bring in a question from the audience, Heather.
Yeah, sure.
So this question is about how do you identify high-risk patients in your clinic, and how do you keep track of these patients, and do you use your EMR to identify high-risk patients, and even using EMR to identify high-risk areas in which they live in?
I can say that we are not doing that. I think that we assume that, perhaps it's a wrong assumption, but I think many of our patients don't have great housing situations. So right now we don't have that. It's not something that we're doing. I think that we know that many of our patients in the East Bay, or at least in my clinics here in the Fruitvale district, are closer to freeways they're closer to industrial waste areas. There's not as much green space. So I think we aren't necessarily looking, and the lowlands in this area is a heat island. So I don't know. Just knowing where our patients are living, not many people are living up in the hills or by the coast.
I'll just add, I mean, in many ways, there's two ways of looking at this, right? You could think about it from a universal education and, kind of think about everyone would benefit from knowing what resources or how to protect themselves during these events. And, myself and Dr. Liu, we work in safety net systems. And so I think we feel like all of our patients would benefit from the different resources or from having these conversations. So I'll just say that I think for the targeted health messaging that we only have done one time as SFHN so far. We had a long conversation about this. Should this messages only go out to those that may be at higher risk during, and this was during a wildfire smoke event, versus should we have it go out to everybody? And at the end, we decided that it should go out to everyone, because everyone should have a chance to receive that information and be able to use it in whatever way they feel will benefit themselves, as opposed to deciding which populations would benefit from it. I do think this question is important from a policy standpoint, and then maybe from a research standpoint, when you're thinking across California and in working with both SFDPH and a bit with CDPH, and with CARB, there is a lot of interest in using the CalEnviroscreen to identify environmental justice communities and also bring resources to those communities that extend everything from providing resources on how to monitor hazards in the area to trying now to think about mitigation efforts. So I do think there is a role for using those mapping tools, and SFDPH has a really cool one that's called a heat vulnerability index. If you want to take a look, it has a really cool, easy to understand storyboard. And that's more for thinking about resource allocation as a city. But I think as providers, myself personally, we've really taken more of a universal education and providing broadly the messaging.
I think one thing I'll add to that as well, since I think that had we the resources to be doing universal messaging, that would be fantastic. What we in resource drop settings, and I think every clinic does have resource constraints. It's been trying to identify sources of funding so that we're able to build sustainable programs, and that includes staff who are able to continue to push this forward, who are not necessarily clinical, since my time is almost all called for clinically, and our working group is all volunteer run, but there are 10 to 20 of us who are poking away every little bit. One of the things that we do is we've used Epic in order to pull out from the problem list specific problem codes for CKD, age over 65, diabetes, heart failure, history of MI, CVA, to be sending one specific text message about that's targeted toward that population versus children under 5, and messaging their parents of, due to your child's young age, health alert from La Clinica that today's high temperatures increase their risk of specific things, and certain things that are about children under 5 and children under 6 months old, of not giving water or making sure that they're drinking breast milk or formula, and that mom should be drinking more water. And then certainly with pregnant women, that's our third population that we have identified. We do have some working groups out in Pittsburgh and Antioch who are doing more air quality work, where they have another grant out there. Something that our working group has helped to work at more of a consortium and larger level is that with the California Primary Care Association, in creating we actually just earlier this week were able to get a budgetary pass to have someone at the California CPA level to find funding for a position to actually seek out funding for that can trickle down, or that FQHCs and safety net clinics can apply to and request funding from, so that we don't need to each be doing our own search for funding for these kind of programs. Since something I would highly encourage is to not be doing this alone. It's impossible to be doing it alone. Trying to find a group of people at your respective clinics who are interested in climate. We meet once a month just to go through each of the different projects that we're all working on. Some people are working on gardening and helping to bring people more in touch with the land. There's other projects that are more at the advocacy at more of a local level for what we can do with regard to policy changes. And then I'm certainly more on the clinical side. There's other ones of us who are working within our own individual clinics to be greening our clinics, in pushing for solar panel installation, having battery powered or battery storage for the days when there are power outages, so we don't need to close clinic. And then, yeah, just the sourcing of where clinic supplies come from.
There's a question in the chat about thinking about how there's a large population of patients being affected by climate change who are not insured or don't have any access to healthcare, and whether or not we should be supporting groups who are advocating for expansion of access to healthcare as part of our work in climate and health. I'm just curious to hear your opinions about that.
Absolutely.
Yeah. I was like, that. Yes, 100%.
No brainer. Okay, sounds good. I wonder, we have about 5 minutes left. Do either of you have just like any advice for maybe folks who just are getting started in patient education about like what's low hanging fruit that they should definitely start doing? just because it can feel a little bit intimidating?
I mean, just starting a conversation. I mean, we all as clinicians do anticipatory guidance, right? And we on many different triggers and risk factors for whatever health. And we just need to start including climate sensitive events as part of that conversation, and providing like resources and instructions on what provider or what patients can do for themselves during those events, and also when to seek care. I think it's, especially now that there are a lot more educational materials out there that are at variety levels of health literacy and languages. There's a lot more available. So I think it's a lot easier now to have those conversations, than maybe like even 3-4 years ago, where what actually works during those events was less known, and gathering of resources was much more put on the individual provider. But there's now a lot out there. So just like asking, hey, how do you feel? Like, do you feel prepared for the next heat event? Or do you feel prepared for the next wildfire smoke? Or how did you do during the last wildfire smoke with your breathing? And then having that be part of the conversation.
I would also add, our climate and health working group got started in the 2020 summer fires when several people wrote a letter to our executive director requesting resources, both funding and time, for us to be forming a working group in order to address these issues that are both affecting patient care, but in some ways, which definitely caring more about patient care as providers here, but also clinics do care about being able to keep clinic doors open and bottom lines. So then in order to be able to also open up these conversations with the board, with administrators, helping them to see that this climate emergency is not going away, to be looking at what are the regional geographic specific climate emergencies that are most likely to affect their clinic, and then preparing for that, both from a prevention as well as mitigation and adaptation standpoint. I don't know if people are aware or have mentioned already, but there's the Harvard's climate toolkit I found to be helpful for a checklist for there's a list for administrators and for clinics that has been helpful just to go through and identifying what is the power source, is there an emergency backup plan, things that I may not be thinking about, administrators may not be thinking about as these climate emergencies become more frequent, so that we can continue to keep our doors open and provide the care that we need to.
I'm going to sneak in this last question from Kathleen. Are there any resources out there for in-house patients?
Oh, I think that so 211 in our area, 211 is helpful. Going to, I think each county's website has not shelters. Oh gosh, they have
the respite centers. Yeah.
Thank you. Yes, and making sure that people know that they can go to public places like public libraries when there's high smoke, high heat days. Just the cooling centers and the list of cooling centers that each county has. And it is certainly a population that is already so marginalized and at such extreme risk that these climate events are devastating to those populations.
I think we're at time. So just wanted to say a huge thank you to Catherine, Allison, and to both of you for educating all of us about how to educate our patients, both I think at the individual level and systems level, to try to move forward and keeping them safe.
Yeah.
Yeah.
And thank you all for being here. Thank you for hosting this, and to each one of the attendees for taking the time.
Thank you so much, Nita and Jesse, as well as Catherine and Allison. Everyone, hopefully this webinar is recorded, and we'll have it sent out to participants soon. So thank you, everyone, and have a good day.